How can cosmetic eyelid surgery make me look younger?
Cosmetic eyelid surgery, also called blepharoplasty, is consistently amongst the most popular elective surgeries performed around the world. Since so much of how we communicate is through eye contact, age-related changes can create a misperception that you're tired, sad, or even angry. I'll discuss some common aging changes that affect the eyes and how I help my patients have more youthful and vibrant looking eyes. One of the most common eyelid conditions I manage are puffy under eye bags. The causes of under eye bags is not limited to just age-related changes, but also due to genetics, as younger people also come to see me with this problem and often complain about how having bags under the eyes make them look tired and older. So why do people have under eye bags? Anatomically speaking, it's generally understood that under eye bags result due to combination of fat volume, bone structure, and the forward displacement of fat, which is referred to as lower eyelid fat prolapse. The definitive treatment for lower eyelid fat prolapse is a surgical procedure. However, if you have a minimal degree of fat prolapse, you may be able to temporarily camouflage the prolapse by augmenting the adjacent bone and soft tissue volume deficiency with a hyaluronic acid filler. Much of the time, the degree of fat prolapse is too great to blend with hyaluronic acid filler. This means a surgical procedure called a blepharoplasty would be appropriate. One of the concerns expressed by patients of all ages is the possibility of losing the shape of their eyes, particularly because of what they've seen occur with celebrities who they feel should be able to afford the best. I help my patients feel comfortable by describing my approach to helping people with under eye bags, which has been successful for decades. It's important to understand that every face is different, so each procedure I perform is customized for the individual. Further, I help people understand that the sometimes shocking appearance of celebrities is due to the plastic surgeon's choice of performing procedures that result in loss of skin and the support of the lower eyelid, which causes conditions such as lower eyelid retraction. My approach is to perform lower eyelid blepharoplasty from the inside of the lower eyelids using a technique called transconjunctival blepharoplasty. Through this approach, the skin and supporting anatomy of the eyes are kept intact, and there is no visible scar, so the characteristic shape of the eyes are preserved. Heavily hooded upper eyelids is another characteristic of aged-looking eyes. For many people, the upper eyelid skin stretches and descends downward, causing the eyes to become hooded. The condition is referred to as dermatochalasis. In addition, the fat surrounding the eyes, called the orbital fat, can also cause the areas of fullness to occur that further contribute to the heaviness of the upper eyelids. Some younger people also experience eyelid hooding due to genetics, oftentimes making them look older than their age. A limited amount of hooding may be improved with minimally invasive procedures, such as with neuromodulators for example, Botox or Jeuveau. However, if there is significant excess skin and upper eyelid herniated fat, then cosmetic upper eyelid blepharoplasty is recommended. This procedure is not just about skin removal. Cosmetic upper eyelid blepharoplasty, in my opinion, is also about sculpting the deep tissue of the skin. This procedure is an art, and anyone who I've operated on could attest to the amount of time I take in designing the pattern for skin removal and for the areas of fat that need to be sculpted. Further, decisions are also made during surgery to address excessive fat or soft tissue overlying the bone structure. I always strive to retain the natural character and shape of the eyes, unique to the patient. I often say what I'm doing is revealing the true shape of your eyes. A diagnosis missed by many plastic surgeons is the presence of a condition called ptosis. Ptosis is commonly seen with aging eyes, as the eyes appear to be lower because of the physical weight of excess skin. But unfortunately, after upper eyelid blepharoplasty, you still can look tired because the ptosis wasn't addressed. Ptosis associated with aging occurs because a muscle called the levator muscle that lifts the upper eyelid tends to stretch over time. When ptosis is seen in a younger person, it's often due to a maldevelopment of the levator muscle, and we refer to this as congenital ptosis. Depending on the degree of ptosis and the function of the levator muscle, I'll perform procedures such as a levator muscle advancement or Mueller's muscle resection. Lines, wrinkles, and discolorations around the eyes can also contribute to an aged appearance. As the skin under the eyes ages due to the loss of collagen, the skin can appear to be more stretchable and have excess. This is, in my experience, a skin quality problem rather than a skin quantity problem. For people with lighter skin, I rejuvenate lower eyelid skin with lasers, such as fractional CO2 and erbium lasers. For some people who have darker skin and are not candidates for laser, I use a radiofrequency device for skin tightening and for collagen stimulation. I also routinely use platelet-rich plasma, or PRP, as well as platelet-rich fibrin, or PRF, to stimulate collagen and improve blood supply for the skin surrounding or around the eyes. Your eyes being an important focal point for communicating, it's no surprise that cosmetic eyelid surgery and other skin enhancement procedures can have a significant impact on how you are seen by others.